Hi, I'm Shashank Bhargava, and you're listening to Three Things, the Indian Express news show. In this episode, we talk about how security operations in Jammu and Kashmir have changed in the past 4 years. We also talk about how 4 members of the transgender community were allegedly harassed by the police in Tripura. But first, we talk about India's COVID-19 vaccination drive. On Monday, the country began administering the booster doses of COVID-19 vaccines to vulnerable groups, including those over the age of 60 and with comorbidities, as well as healthcare and frontline workers. Now, although these are booster doses, meaning the third dose of the vaccine, the government has been calling it precautionary doses. But the important thing to note, of course, is that a booster shot or a precautionary dose is valuable because we now know that the immunity generated by vaccines reduces over time, and an extra shot of the vaccine helps maintain that level of immunity. Now, over the past few months, there have been a lot of conversations about the fact that the third dose should be different from the previous 2 doses. It was suggested that this would give the person more immunity. But India for now has decided that the third dose will be the same as the previous ones. So what prompted the government to take this decision? To understand this, we spoke to Dr. Sanjay Pujari, who is a member of the ICMR National COVID-19 Task Force and an infectious disease expert. And he explained that there were 3 reasons for this.
So the first issue is scientific evidence for heterologous boosting. That's what we call when you use a third different platform over the primary vaccine series. Now, if you look at global evidence, there are 2 aspects in evidence. One is what happens to the immunity and measuring immunity after a booster. And second is actually how does that translate into vaccine efficacy or effectiveness in terms of reducing infections and serious illness. So as far as immunogenicity is concerned, at least in the short term, there is a lot of evidence to suggest that heterologous boosting produces higher immunogenicity, particularly neutralizing antibodies versus homologous boosting. In terms of vaccine efficacy, at present there are only 2 studies available, and another one from Israel which was published yesterday, which looked at the efficacy of heterologous boosting versus homologous boosting in the UK study and in the study from Chile, where they used primary AstraZeneca vaccine in the UK study, which is the Covishield in India, followed by an mRNA boosting. They did document higher vaccine efficacy for symptomatic illness, but for hospitalizations, ICU infections, and mortality, there was not much difference. And the same thing was seen in Chile, where they use inactivated vaccine, which can be considered Covaxin in India, followed by a adenovirus vaccine like Covishield. And they did demonstrate a better absolute number percentage responses in vaccine efficacy, but the differences were very small when you considered severe illness and ICU admissions.
Apart from there not being much difference in serious illness and ICU admissions, Dr. Pujari says that the latest Israel study also shows that taking a booster dose also reduces symptomatic and asymptomatic infections in the short term.
What that means is that, of course, serious illness can be prevented, but even infections in the short term can be prevented. So that is about the evidence. So the evidence is not very strong to wholly shift towards a heterologous boosting strategy. We need to await results both globally and in India, where we are awaiting results from studies from CMC Vellore, for example, which is looking at Covaxin and Covishield boosting.
And the other experts agree with this point as well. Many experts have told the Indian Express that it makes sense to give the same vaccine as the previous 2 doses until there is sufficient data to make a policy decision. But moving on from evidence, which was factor number 1, Dr. Pujari points to factor number 2, which is looking at what regulatory agencies around the world are saying about this.
So that the World Health Organization's advisory is that homologous vaccine schedules should be considered as a standard practice because there is substantial data on the safety, immunogenicity, and efficacy of these schedules. And so is the European Medicine Agency also suggests a heterologous booster strategy only to be considered as an alternative strategy, provided you have flexibility in vaccine supply and availability. The third aspect is, of course, vaccine supply, availability, and scaling up when you start rolling this out in a uniform manner. So it's very important to achieve a right balance between the scientific evidence, effectiveness, safety, and availability of the vaccines and its supplies. And in this context, in all this, at this point of time, it looks like this is a right decision, which may be modified as more evidence comes in future.
So, just to recap, the decision by the government makes sense to experts right now because the lack of available evidence regarding mixing of doses, especially Covishield and Covaxin, what regulatory bodies are saying, and the fact that we might face availability and supply chain issues if we switch vaccines at this point. Because while 130 crore doses of Covishield have been used in India so far, only 19 crore doses of Covaxin have been used. Plus, the population under the age of 18 will only be receiving Covaxin in their inoculation drive. And using more of it for adults right now could lead to a shortage. But talking about the benefits of the booster doses, Dr. Pujari says that they could help in dealing with the current wave as well, especially when targeting the vulnerable populations. Because, like mentioned earlier, studies have shown that booster doses can help reduce infections in the short term.
So the idea is that for vulnerable population where the T cell immunity wanes off because of age, plus comorbidities, which itself is a higher risk for developing severe disease in the context of COVID-2 infection, you would have the benefit of preventing severe illness in the vulnerable population. In the short term, you will obviously prevent infections. Now, why frontline workers? Frontline workers are somebody who take care of vulnerable population in their hospitals and would be the first responders in the presence of a surge. So preventing infections, whether symptomatic, asymptomatic, is also a priority in that group. And in the short term, within about 1 to 2 weeks, the neutralizing antibodies kick up after a booster, and it will prevent infections from happening. And that would prevent further transmission to the vulnerable population in the hospitals. It will also prevent symptomatic illness amongst healthcare workers. So there is less absenteeism which is available in terms of hospital care, which in the context of a surge may demand a large amount of people not to be sick with this. So this is an excellent idea and excellent target groups initially, though I feel this has to be expansive to also include immunocompromised patients who don't have an adequate immune response because of their immunocompromised status to vaccines. And boosters should need to be offered to this vulnerable population as well.
Now, even though the cases that we are seeing in this third wave are much milder, and so far hospitalization and deaths have been less as well, Dr. Pujari says that he is concerned by the sheer numbers that we are seeing right now.
So the peak will be high and it will be rapidly increasing as we are seeing. The doubling time is very, very fast. Even if it causes less severe illness, say as compared to Delta, because of the rapidity of its spread and the absolute number of people getting infected, there may be some concern that it may still overwhelm healthcare systems. We need to wait for at least 1 to 2 weeks to see the real impact on hospitalization because the virus start getting transmitted today, even if it is milder, because of the sheer numbers of people and the rapidity with which people are getting infected, which may turn into people needing hospitalizations. There may be a little concern about in the next few weeks that hospital systems, more patients may turn up into hospitals. This is exactly what is happening in the US today, where there is a record increase in hospitalizations happening because of about 2 weeks ago, they had a rapid Omicron surge there. So we need to watch carefully over the next 2 to 3 weeks.
And next we talk about Jammu and Kashmir. It has now been nearly 2.5 years since the special status of Jammu and Kashmir was scrapped and the state was divided into two union territories. At that time, back in 2019, the valley was flooded with hundreds of security forces and detentions took place on a very large scale. Among those detained and put under house arrest were also the mainstream political leaders of Jammu and Kashmir. Since then, the scale of security operations in the region has significantly expanded. Indian Express's Naveed Iqbal recently studied data compiled by the government over the period of 4 years and found this to be true. She now joins us to talk about what this data reveals about the security operations and the way militancy and perceived threats are being dealt with. Naveed, you looked at the data over these past 4 years. In what sense have security operations changed in the region?
So this can be seen as a shift in approach or an expansion of the ongoing counter-terror operations in the valley. The shift is towards dismantling the base of the pyramid or the structure, at the apex of which is the militant that wields the gun. So within the security establishment now in J&K, the thought process has been that instead of tackling militancy as a monolith and looking at it through the barometer of killings and operations over the last few years, they are working on a more comprehensive strategy to counter, say, every aspect of militancy, whether that is terror funding or arrest of OGWs that provide logistical support to active militants, or for that matter, anyone that may be directly or indirectly involved in militancy in J&K.
So earlier you would target active militants, people with weapons, people looking to plan terror attacks. They would basically look at militancy-related incidents. And the idea would be to essentially eliminate those people, kill those people. So in what sense are security forces going after people now?
So one of the senior security officials who we spoke to for the story said that until about the end of 19, counterterrorism operations targeted only elimination of active militants. So you went into a place where you suspected there were militants and there was a shootout and there were bodies to count. But now the focus has shifted to addressing the entire terror structure, as they call it. And also not just killing active militants, but also targeting individuals through UAPA, the Unlawful Activities Prevention Act, and the PSA, the Public Safety Act, that is operational in J&K. So both of these acts provide for large arrests within J&K also, largely within Kashmir.
Okay, so during these past 3-4 years, how many people have been arrested under UAPA and PSA in the region?
So in UAPA, if you look at the last 4 years, 2018 was 906 persons arrested in 409 cases. That increased to 437 cases and 918 persons arrested. By 2021, this becomes 497 cases registered and persons arrested is 838. So over the last 4 years in total, there are 1,900 cases registered and over 3,600 people arrested under UAPA alone. Of this, about 1,300 are still in jails. Speaking of PSA specifically, the total number of cases over the last 4 years is over 1,500. And this is also the number of people are detained individually under like a one PSA case. Of this, about 397 continue to remain in detention. The highest number of PSA cases which is 287, which accounts for a vast majority of this figure.
So these are obviously huge numbers in terms of just detaining people and putting people in custody. And from what we understand, this crackdown has drawn a fair amount of criticism from the political leaders in the valley. You spoke to many of them. What did they have to say about all this?
The mainstream political leadership of J&K has strongly criticized these moves, especially as Mehbooba Mufti calls it, the weaponizing of central agencies like ED or income tax authorities, etc., NIA, all of these agencies. When we spoke to her, she said that dissent had been criminalized and the only way to deal with dissent in J&K has now become dealing with it through harsh laws. We've seen large-scale detentions leading up to 2019 and even after that. So even Mehbooba Mufti's mother was called into questioning by the ED. And she says that no one with a contrary view can escape the GOI's punitive actions. We also spoke to Sajad Lone, the chairman of People's Conference. He said that it is surprising that somehow the current establishment considers that by using these operations, by using violence, they will be able to control violence. So he said that previous governments understood this and understood that this was counterproductive. So that's been their argument. Even the Hurriyat has clearly criticized the use of agencies in J&K.
Okay, and looking at this sort of objectively, has this clampdown actually helped with the security situation in the region? Like, has it helped bring militancy down?
So if you speak to security agencies and senior officials, according to them, this does work because the militant is only at the top of this pyramid. So by dismantling the structures surrounding this person or this monolith, then you can effectively counter the narratives, counter the ways and means in which militancy is supported. So for them, it's a strategy that works. But the only challenge to this is that recruitment keeps pace with the deaths.
So that means even though you are detaining so many people and at the same time the earlier process of elimination is still on, you still see younger people getting recruited into militancy.
Recruited with a very short shelf life, like under a year. So last year there were 134 militants active, of which 72 have been killed, 22 arrested, and 40 are still active. And the current number of active militants in J&K as of now is 169. So most years it's around 200. And the other thing to consider here is that cross-border infiltration has gone down because in January, India and Pakistan reiterated their ceasefire treaties. And so as a result, while 51 successful infiltration bids took place in 2020, this year 34 or so have taken place. So that's also a fact to consider in looking at militancy numbers this year.
And with this change in strategy when it comes to tackling the security situation, how would you say it has affected the day-to-day lives of people there?
I think that, as our edit says also, that while this may be effective counter-terrorism strategy, this also instills a certain fear in the local populace and the common people. Because now, even in terms of like employees that have been, say, sacked by the government, etc. So you could have any association, you could have any remote association, and you could still be within the ambit of doubt. So that is what has been criticized the most, and that is what sows the fear of alienation amongst people.
And in the end, we talk about how 4 people from the transgender community were harassed by the police and journalists in Tripura. These 4 people, earlier this week, were allegedly made to strip inside a police station in Agartala in order to prove their gender, and were forced to submit a written undertaking saying that they would not cross-dress ever again. Indian Express's Debraj Deb, who reports on Tripura for the paper, tells us about what led to this incident.
Well, this thing is that these 4 transgender individuals that you speak about, they are mostly in the early youth. They are 19, 20-year-old people. They're all residents of Agartala and they are professional makeup artists. Now, what happens in Tripura is it's a small state and there is a lot of social taboo and stigma around LGBTQIA. And unlike many other states of the country, Tripura doesn't have a formal community which asserts their LGBT rights or identity. And there is no pride rally. There is nothing that could probably be referred to as a community in that sort of way. So what happens is mostly LGBTQ identity is hidden in many cases. And these people themselves say that we don't assert our identity much that way. And these 4 people that we have in the news now, they went to enjoy DJ party in a city-based hotel in Agartala on the 8th of January. And they had a good evening. They were coming back from the hotel. And it was a bit late in the evening, probably about 10:45 or 10:40 or something like that. And that was when, according to these 4 people, they were intercepted by a few policemen and 2 journalists. Journalists as in reporters of some local news channels. And these journalists and policemen had some kind of presumed notion that they were cheating some people, they were swindling money out of some people with fake gender identities, and they were questioned why they had cross-dressed. And the trans people told us that they clearly identified themselves as transgender. They invoked the rights given under Section 377 or the Nalsa Act judgment, and they said that they had done nothing wrong. But the police allegedly arrested them, took them to the women police station of West Agartala, and there they were allegedly forced to strip, prove their physical gender identities, and they were made to walk from the West Agartala Women's Police Station to the West Agartala Police Station, which is very close actually, just on the other side of the road. But that was in actually almost midnight, 11:40 or 11:45 on that intervening night of 8th and 9th. And there they alleged that they were made to sit on the cold floor throughout the night without any food or water. And they kept on asking for food because they were hungry, but they were denied any eatables or drinking water. And it was only in the next day that they were released.
And Debraj, during the time that they were being made to allegedly strip in the police station and all this was going on, were the journalists who were earlier there with the police also present?
Yes, they have said those journalists were there and they were recording the whole thing going on, this whole harrowing episode going on with them. They allege that those journalists were recording this stuff, and some of those recordings have gone online. They are now viral on different social media. And even after they were released on the next day from the police station, they found the life was very hard back home, because by this time this video had made it through to different news channels, local news channels, and some social media. And soon after this videos got viral, like I told you before, Tripura has a lot of stigma and taboo around LGBTQIA. And these people who were not earlier asserting their LGBTQ identity, now they were finding it very hard to stay at home. Some of them say they have been forced out of their homes, some forced out of their rented places, and they are facing bullying and taunting in their localities. And since they are professional makeup artists, their profession has become hit. People are not going to their places anymore to get any kind of job done. And more important than not, their families are being harassed, right? There is a lot of name calling and shaming, according to them. There is this bullying going on around society. And not only them, there are also other trans people in different parts of Tripura who did not assert their identity before, but people were perhaps having some kind of notion about them being trans people. They are also finding life very hard.
And now you spoke to activists within this community. What did they have to say about this incident?
So one of these people that I talked to, Ms. Sneha Gupta Roy, she is a trans woman herself, the first trans woman who underwent a gender reassignment surgery and became the first trans woman of Tripura. She is also a very prominent LGBTQIA activist. She has said that this issue points out the stark absence of consciousness and awareness about the evolving gender norms. And what is most striking that they have said, both the victims of this incident and the activists, what they have said is that it is very baffling how the police doesn't know the law. They were constantly informing the police and the journalists that they were transgender people. They were invoking the rights of 377 of the Nalsa judgment. But still, nobody was ready to believe that there is something called a transgender. And one of these journalists who were there, who was alleged to have been involved in this incident, I have spoken to him personally. And that journalist told me that I didn't know about this LGBTQ issue. And I just knew that there are some transgender people whom we call Hijra, and they were certainly not them. So I thought that maybe there was some kind of identity mischief going on. And somebody informed me that there is some kind of fake identity issue going on, and some people are cheating some other people with fake gender identities. I went to cover the story. But since I was talking and I was asking most of the questions, my voice became prominent. The other journalists didn't ask any questions. And after understanding the whole issue, I didn't cover the whole story in my media. That's what that journalist fellow said. That journalist who is now accused of this whole thing, that fellow told me. He said that he didn't run the story in his media, but some other journalists ran those stories in their media. And because his voice was prominent, that he's the one people are usually blaming. That was his defense was. But then again, the other journalists, activists, and the victims of the incident themselves have totally rubbished this excuse, saying you can't tell you don't know when you're a journalist working in the field, right? If you don't know, why didn't you check up with those people back in office? So why didn't you know it before you came in the field? So certainly this is a pretext that he is trying to take recourse to, but I'm afraid it is not finding much traction among any of these people involved in this incident.
And now after all this, have, these 4 people tried to file a complaint regarding this incident?
Yes. So now the trans people who have survived this incident, I should say survived this incident, they said that they went to the police station on the very next day to file a police complaint, but the police did not receive their complaint. And eventually they consulted a lawyer and they filed a complaint Monday evening, where they have sought proper justice and they sought punishment for the people who are involved in these things, and they have wanted a kind of security for their identity and their livelihoods. So this is the situation as of now. But what I think is very important is that there is very high absence of discussion on this topic. Even after the incident happened, while I was trying to do the story, I was trying to get through different authorities, people in the government or the police. Almost no one was very eagerly ready to talk about. Eventually, a very senior police official, he spoke with me and he said that a report has been summoned on the issue and police officials were involved in this incident. They were known to have arrested those trans people on the grounds of preventive arrest on that night of 8th January. But even preventive arrest needs some kind of legal ground which forms a basis why the arrest is required. Those grounds are not yet very clear. The report was summoned and it will probably be there with the police authorities in the next few days. But then the police itself has advised those aggrieved trans people, and these senior police officials of Tripura police have said that if anybody feels there was some kind of injustice going on, they should approach the human rights authorities or the Police Accountability Commission, and they have assured that if anyone is found responsible, no one will be spared. So there is some kind of stern talk going on around, but like I said, Tripura is a small state. These evolving gender non-binary, identities, gender non-conforming identities are not yet very popular here, not very well known here, and perhaps this ignorance is the only reason that these things have happened. But then ignorance can sometimes be very deadly. This is one of those examples, I guess.
You were listening to Three Things by the Indian Express. Today's show was written and produced by me, Shashank Bhargava, and was edited and mixed by Suresh Pawar. If you like the show, then do subscribe to us wherever you get your podcasts. You can also recommend the show to someone you think will like it, share it with a friend or someone in your family. It's the best way for people to get to know about us. You can tweet us at Express Podcasts and write to us at podcasts@indianexpress.com.